welcome to today's Way Forward Workshop Leader Lunch Break, where we are thrilled to welcome Tiffany Scruggs. The Greater Cleveland Food Bank set on a bold journey to serve its clients with more than food. The vision was to create a community resource center. When that vision was realized, it was clear that there was one person who was uniquely qualified to lead the execution of the effort, one person who brought both empathy and passion to the role. That leader is Tiffany Scruggs. Tiffany brings to her work over 20 years of servant leadership, honed by deep experience in the nonprofit sector. Her work has always been leading social services programs and connecting community resources. In the press release announcing her appointment, a colleague said, "Her positive energy and optimism are contagious. Tiffany understands the needs of our community and keeps our neighbors at the forefront when making decisions." Tiffany herself has articulated her deep commitment to addressing the root causes of hunger, such as housing, healthcare, and underemployment. In the few hours when she is not serving at the food bank, she serves as president of the board of Family Connections and sits on the board of the Cleveland Leadership Center. Her impactful work and indomitable spirit was recognized by Crain's 40 Under 40 and by Cleveland Heights City Council as an amazing woman of Cleveland Heights. We are proud to recognize her as a Cleveland Bridge Builder alum. Welcome, Tiffany.
Thank you, Marianne, and it's really glad to be here with all of you today. Happy Wednesday. I apologize. I am slightly under the weather, but there is no way that I would miss the opportunity to showcase our work. So I'm going to try to bring my level 10 energy. So please bear with me if I have to wipe my nose or do something. Want to give a shout out to all of you. Want to give a shout out to our Greater Cleveland Food Bank team, as they're actually having a watch party to really celebrate and showcase our work. So shout out to board members and just all of our partners on the call as well. So just want to go ahead and remind folks, I would be remiss if I didn't give you just a little blurb about our new strategic plan, working together to end hunger for today, tomorrow, and a lifetime. And so really our Community Resource Center is really focused on ending and addressing hunger for a lifetime by creating that national model. And we've done just that. We've been open since November 2nd to the community, and we have tons of impact to share. So as a reminder, our mission is to ensure that everyone has the nutritious foods that they need every day. Historically, we've done that in two ways: through our partner network, through the distribution of food, but we've also helped to connect individuals who are income eligible to SNAP, which is food stamps, which provides as our country's largest defense against hunger. Those of you, thank you, who have joined us at our new Quake Partner Distribution Hub. So our expansion is totally been activated. The first phase was to create a larger space for our partners to increase our ability to serve more food in our communities within the 6 counties that we share. Phase 2 is our Community Resource Center, which I'm going to talk more about, but also talk about plans for the future, which is to also operate a Community Resource Center on the west side of Cleveland and Cuyahoga County, but also our south side territories, which are Ashland and Richland. Total, the $80 million project will allow us to really address and move the needle when we think about the root causes of hunger. So why is this important? Why a Community Resource Center? We reached a high number in terms of our last fiscal year, fiscal year 23. Take a look for yourself, but we were able to reach 401,000 unduplicated neighbors. And so we know that we have to do more than food. We have to do more than just distributing food. So just wanted to highlight some of our data in terms of our work. For those of you who were able to join our ribbon cutting that we executed November 1st, this is just to highlight the opportunity to reach our neighbors and to provide access to fresh fruits and vegetables. So the vision for our center is to create and offer a transformational community center that increases access to healthy foods and connects those that we serve to other key nonprofit partners in a collaborative way. But we didn't do that in a vacuum. Over a 2-year period, we reached out to our neighbors to truly understand what types of services would our neighbors find most appealing. What list of organizations had they built trust with and were they most familiar with? This is just an opportunity to share with you some of the feedback from our partners that we've surveyed along the way and also our neighbors. And so opportunities, partnerships, building relationships all under one roof, one location, nurturing, removing those barriers. So this model really speaks to all of these words, and our partners and communities have acknowledged just that. So let's talk about who's eligible for our services overall. The first quadrant is focused on SNAP, which is food stamps. As I mentioned, SNAP provides the largest defense against hunger, providing 9 times the amount of food as food banks can. When we look in terms of those who are eligible for food at our Community Resource Center, you will see the income thresholds here on the right. So just wanted to highlight that level of information so that you're familiar about who's eligible. For us, you will hear us talk about neighbor instead of client. And so neighbor is really a positive connotation and is really more accepted at a national scale. And we've incorporated national approaches along with local level data to really make sure that we're offering a welcome, highly dignified approach. And we also expect our partners and volunteers and all staff to do the same. The Community Resource Center is important because similar to the social determinants of work, social determinants of health, we know that our neighbors have more than food needs. And so you'll see this diagram that really hones in closely on health, housing, and also employment. We know that if you don't have access to higher wage paying jobs, it's hard for you to sustain. But at the Community Resource Center, we're able to address really removing those barriers, but also offering budget relieving services for our low income neighbors in the community. We know that if you're on a fixed income, it can be hard to go from different places to access services. So once again, we are thrilled to serve as conveners for this national model. So just to remind you, we've offered a $13 million renovation at our Community Resource Center, which takes place at our South Waterloo facility. Really, it's like a concierge style opportunity for neighbors to be greeted with dignity and respect when they walk in the door. Neighbors have an opportunity to receive a cup of coffee, to fellowship and engage with one another, building relationships among neighbors, but also increasing awareness and educational opportunities from the 16 other services that are serving as our anchor sites. Our guiding principles. We know that it is critically important to really be thoughtful about increased economic stability within our neighbors. So similar to the work that United Way has taken the lead on, such a valued partner that we're honored to have them be one of our 16 nonprofit partners. But once again, I'll hone in on that respect, the dignity, that safe and welcoming and optimistic environment. And I will say, as Marianne mentioned, I am just honored. This is my dream job. And so throughout my life, I've had some hardships, and it's okay for me to talk to neighbors about hardships that I've experienced to give our neighbors that whim of hope, that inspiration, and that encouragement to continue. We know that we have such a captive audience within our communities before food distribution begins. And so we will continue to optimize this space to make sure that neighbors truly understand the goal of our Community Resource Center, which is now open. So when we take a look here at the other nonprofit organizations that have joined forces with us, and once again, we are honored to serve as conveners, this kind of highlights market hours, but please note that the building itself is available to our community 8:30 to 5 p.m., with the exception of 7 p.m. on Wednesdays and Thursdays. This is just what we've been able to replicate for our community, a free grocery store style experience where our neighbors can pick items most favorable to them. So when we take a look, once again, being mindful of the various services offered. Yes, we know that employment, housing, and healthcare serve as the 3 main drivers of food insecurity, but we learned so much more about the importance of having shoes and clothes for kids on site for households with children. It's critically important to have access to services like legal aid. We are excited tomorrow to offer financial services as we welcome the PNC mobile unit to our center. And so our job is to make sure that our neighbors understand all of the great service opportunities so that they can join us and make sure that they have access to financial services as well for those that are unbanked. When we've reached out to our community, we understand that there's a lack of trust within our banking system, there's bad debt, or just once again, culturally not familiar with the banking system. And so we look forward to joining financial institutions such as PNC, along with others who are housed under Benjamin Rose, for an example. This just gives you a sense of how the setup of the building is truly a community space. So what you see in red is dedicated for our community. And most of the color is red because this building is dedicated to our community. So thank you so much to all of our donors on the call. We've had phenomenal impact, and I just want to take a look at this early data. A little over 30 days of service, you will see that we've been able to reach almost 9,000 unduplicated people that have benefited from food. Almost 3,500 unduplicated households have visited the center. You'll see total market visits. And so once again, the community has to become more familiar with all of the additional services that we're offering. 47% of household individuals have been seniors or children. And we know that unfortunately, Cleveland is still pretty high in terms of child poverty. We also know that seniors will make up the largest portion of our population. And so while we have our work cut out, we definitely have established nonprofit organizations focused in both of those populations. We could not execute our mission without the great support of our volunteers. And so I want to encourage all of you, if you have not joined us, whether at our Coit location or at our Community Resource Center, we would love to have you. There's a link for you to be more familiar with. We also ask that you share this with your networks. These are just to highlight some of the visuals in the center. And so this first area, Hello Neighbor, once again, welcoming, vibrant. Thank you so much to Janet and Mark Smith, who are also on the call and serve as our valued board members. There's also opportunities for visiting nonprofit organizations who want to engage neighbors at the center who don't serve as our anchor partners. For example, we've been focused heavily on open enrollment for neighbors in need. And so we've housed managed care organizations, and a must-have is our access to free cell phones and wireless devices. There's an opportunity for you to request to be a visiting partner at the bottom left. In addition to access to healthy foods, we also have a demo kitchen where neighbors can learn how to prepare meals, how to prepare them in a healthy way for items that might not be most familiar in terms of their dietary needs. If you're interested, any chefs on the call or those that just love to be involved in culinary opportunities, there's an opportunity to make a request at the bottom right so that you can engage with us at our Community Resource Center for our health and nutrition education efforts as well. So these are just some feedback. We continue to survey our neighbors, we survey our partners, we survey our overall community to truly understand the impact and the experience. And so just want to take some time to just share what our neighbors have said about their experience when they come into the center. This person was actually employed by Cuyahoga County Human Resources and had been involved in some fundraising efforts. But times get hard because of needing to support her diabetes in terms of insulin and didn't have additional money. But she was welcomed and treated with dignity and respect. And so she'll be back and she'll tell another neighbor to come and receive the valuable support. Opportunities to play with children. So we have a family playroom that's operated by Family Connections. And so once again, children don't always have toys in their home. They don't have books. We provide access to free books. And once again, really honing in on that welcoming environment. So our plans to evaluate our work. As mentioned, we always are surveying the community to truly understand the level of satisfaction, overall impact on food security, and connections to other partners. Being thoughtful about access to that healthy choice market, and being thoughtful about how that drives medical ailments that our neighbors might have. And also, we're developing long-term evaluation plans to truly understand our impact. And once again, this is not a short-term outcome. This is really a longer-term strategy that we will be engaged in. So I highlighted plans for the future. We're not done yet. We have a commitment to our community, and so we will begin to work with partners to establish a community resource center on the west side once we optimize the space. Either one in Ashland or Richland, we know that poverty in rural communities is slightly different because there's just not as many access to assets such as what we have here in Cuyahoga and other metropolitan counties. Being mindful of underserved community, access challenges, and also making sure that we have community buy-in. So with that, I know that we want to leave an opportunity for questions because I'm sure that you all have thoughts or want to learn more, and I would be happy to share and answer those at this time. Thank you all so much for your attention.
Tiffany, thank you for sharing all the amazing work that you all have done in just a short amount of time. And really looking at those numbers that you've shared of usage already, that's just in such a short period of opening. How did that response align with what you expected in terms of usage of the services upon opening?
I will say that, we knew that we would have a draw, but we did not know that it would happen so quickly. We also continue to operate our drive-through muni lot distribution, and we've also started to encourage and invite those attendees to the center as we will sunset with that operation. Next Thursday will be our very last distribution. Who would imagine after almost 4 years that we would be in that space? So once again, right now we're averaging about 250 households per day that we are reaching at the center, and we can expect a continuous increase as we move forward.
Can you walk us through the process of how somebody who comes to the center can get connected to all of the various services that are housed under the center's roof?
Sure. So we continue to work with our partners to share out their expectations and when they'll be on site. And so right now we still have a few partners that are moving into the space, but we've been also collecting the neighbors' requests for all of their services. So when someone walks into the door, they're greeted by a volunteer indoor staff. If they're there generally for food, we're also able to inform them of which partner organizations are on site that day to engage and meet their needs. I will tell you right now, it's utility assistance time. We're also preparing for free tax preparation that we will highlight Benjamin Road services as one example in terms of being thoughtful about what our community needs. But we are tracking what services our neighbors are asking for to share with our partners as they establish their capacity and their ability to serve the community at the Community Resource Center on a full-time basis.
How did you build the relationships with the community partners to have them become a part of the resource center?
So the good news, our organization has been engaged in outreach efforts. And what that means is community engagement in person and also operating a call center. And so with the in-person opportunities, we have already collaborated and built relationships with many of the organizations that serve as our anchor partner organizations. And so for us, once again, surveying the community, our neighbors let us know what organizations were they most familiar with. And also that helped us to bring all of the partners together, which we started to have conversations almost a year ago with the involved partner organizations to build trust, to truly understand what next steps. No, everything is not perfect as of today, but we recognize the opportunity to enhance our operations. And so just having constant conversations, constant feedback. We worked with a consultant who was really helpful in terms of us accessing our partners, working through agreements. And so we continue to serve the community in a collaborative way because of all of those conversations previously.
Is there anything that has happened in these early days that was unanticipated in terms of service or usage?
Yes, for us, we recognized the resiliency in our community, right? But we unfortunately have had neighbors who have expressed suicidal thoughts to us. And so we've quickly activated organizations like United Way. We've actually activated Murtis Taylor in terms of the crisis intervention services, and they've been on site as a visiting partner. But we've also had the opportunity to talk to Metro Health leaders because they will operate a federally qualified healthcare clinic as we think about access to medical and healthcare services. And so for us, we were not expecting that, but our team is equipped to quickly rally around someone in crisis and in need to make sure that they have additional support. And so that's one example, just in terms of not being quite ready or identifying that that would be a need so early on. But the holidays can be tough for people, and we recognize that. And so now this has helped us with additional training that our staff that we need to be engaged in as we move forward to properly serve the community in need.
And what is the geographic distribution of your neighbors?
So for us, we serve neighbors from a variety of communities. So because we serve 6 counties, neighbors come from far and wide in terms of access to services. So for us right now, we focused heavily on 44110 and surrounding zip codes. So that's North and South Collinwood. But we have neighbors that come from Euclid, Lake County, just being mindful of need. Also being mindful of access to all services under one roof. It's exciting for our community. And so we've been able to reach out to new individuals and new households to help them understand our plans to really address the root causes of hunger and poverty.
Bring something like this to life is a huge undertaking. What were some of the challenges you experienced along the way to get to the opening, and how did you work to overcome those?
I would just say bringing folks all in one room and having a conversation and gaining consensus can be a challenge because everyone has their own desires or missions that they want to execute. And so I would say building trust amongst partners that might not have had the opportunity to work closely with one another. I won't say it was a challenge, but that's where a good amount of time was spent. And we also will continue to do just that. Clearly, because of the pandemic, delays and construction challenges, material supply chain issues, inflation that drastically changed our original expansion budget was definitely a challenge, but our board and supporters quickly activated to ensure that we were able to be successful and achieve our fundraising goal for the project. And also just educating the community. When the building's under construction, and for me personally, if I see a neighbor at a construction site, the need is there, right? And so making sure that we equip our community for this change because it's a massive change. And so that can also be challenging, but we continue to push out and educate our stakeholders so that they can help us spread the word in terms of the great work that we're doing and as conveners of this massive operation.
Are there services that you would love to be able to provide at the Resource Center that you have a gap in a partnership that you're looking to fill?
I think more as we learn more and really, have responses from our community around behavioral health and mental health services, I think we can dig a little deeper there. And so our team, we're quickly having conversations with our participating organizations, but also reaching out to other organizations that specialize in that work. Also helping Shoes and Clothes for Kids, who traditionally served teachers for CMSD school district, and how do they execute and increase their capacity to serve the individuals. And so those are just adjustments that we're going to make alongside our partners. As an example, being thoughtful about access to diapers. We have the Diaper Bank of Greater Cleveland there. And so once again, this move has allowed for them to increase their capacity and really maximize efficiencies. And so for us, working together to establish how organizations like that can serve the individual so that needs can truly be fulfilled while at the Community Resource Center.
Have you heard from other food banks across the country wanting to replicate your model of service?
So if you know Cleveland, if you know the Greater Cleveland Food Bank, we like to go big. We love to be trailblazers. I will say that we've spent some time doing what's called resource trips. We've gone to food banks in New York. We've visited food banks in Texas. We visited our sister food banks across the state to understand who's providing a social service arm in their food bank. And so I will say that this is truly a first of its kind at this scale, but we definitely have learnings that we've incorporated from other food banks across the country. Also, being one of 199 food banks under the National Feeding America umbrella, there's a lot of approaches and a lot of shared learnings that our team has incorporated into our everyday work. And so we will continue to focus on some of those learnings and integrate that. Once again, focused a lot on economic mobility of those that we serve, meaning to make sure that budget relieving services are available and making sure that our neighbors can sustain moving forward. But absolutely, reaching out to other food banks and social service organizations was a part of our exploration this past 5 years.
Throughout this entire journey of bringing this to reality, what has surprised you the most?
You know, a few surprises for me. I'm learning a lot about construction and architecture, drawings, and all those things that comes with this magnitude of a project. I don't want to say surprise because we are truly in a very engaging, highly philanthropic community. But it has shocked me our ability to raise funds for our entire expansion in such a short window. So once again, thanks to all of our donors and supporters who have helped us successfully fundraise $80 million for our full expansion. So for me, that's a shock because I come from small nonprofits, and so just to see the success of that has been surprising.
So Tiffany, this is a huge project. You are seeing neighbors with so many challenges coming into the resource center, yet you keep such a positive energy and attitude. How do you approach your days? How do you keep that positivity going?
Well, I'm hoping we all can agree, particularly recovering from the pandemic, every day that we open our eyes is a blessing. There's always something to be grateful for. I could tell you tons of stories of hardship, but once again, acknowledging the resiliency of our community. I personally have been on the other side in terms of having to access some services, relying on SNAP, and so I'm able to use that hardship to help keep our neighbors encouraged and say, "Hey, I have a master's. I'm an amazing woman." All the things that Marianne shared, but to keep our community inspired. And so for me, the glass is always half full, always half full.
So for those of us who are on the call, how can we best support you, the resource center, and your neighbors?
I would say we'd love to have you just stop by the Community Resource Center and take a look for yourself. Also, volunteering goes a long way, does not have to be at the Community Resource Center. It can be at our other facility or even a partner organization, but just broaden your volunteerism because that is a continued way of paying it forward and truly staying close to community need. And so I think I really encourage all of you to join us as we serve the community in this thoughtful way as we move forward.